Hello and welcome to my presentation on forecasting the impact of COVID-19 on public sector services. My name is Stephen Simpkin and I'm Data Science Fellow here at Essex County Council in the Analytics and Data Science team. So today I'm going to be covering a few things, and I'll start by saying why I hate forecasting, but rest assured I end by saying how much I actually love forecasting. In between, I'll cover the work we've been doing here at Essex in forecasting the impact of COVID-19 on our services and share with you a few tips that I found useful in doing forecasting. So to begin with, why do I hate forecasting? Well, there's three main reasons for this. First is forecasting is not an exact science. Second, forecasting is a word that everyone understands, but a practice that very few do. And finally, forecasts are almost always wrong, and anyone that tells you otherwise is probably trying to sell you something. So this first point I'm slowly making my peace with. Forecasting is 50% science, 50% art form, has become a bit of a nerdy catchphrase of mine over the last 6 months. On top of that, all the letters you need to spell the word science or art are contained within the word forecast. So most people that work in kind of data science or social science or research or other professions spend their lives seeking this kind of hard evidence, unequivocal, unarguable and unbending evidence. So to compromise the integrity of this with kind of bloke down the pub says adjustments or assumptions, as you and I might know them, it just feels counterintuitive to everything we've ever learnt. But in the public sector, perhaps in the private sector as well, this is the only real way that forecasting can work. So the second point is perhaps the toughest challenge I've faced in my time here. That if I was to talk about supervised machine learning algorithms, for example, outside of my team, very few people would know what I'm talking about. But they also won't care. They won't try and kind of feign understanding. They won't want to kind of understand the nitty-gritty details. All I want to know is what they can do with it, and I'll trust in how accurate I can tell them it is. And that's the dream scenario. But everyone knows what the word forecasting means. It's just saying what is going to happen in the future. So the word alone is easy for anyone to comprehend, certainly easier than supervised machine learning algorithm. And so with that basic understanding of the word comes a level of expectation. And that is without people knowing their kind of strengths and limitations of forecasting, without knowing what the requirements for conducting forecasting, without knowing the kind of caveats, without knowing the appropriate applications for forecasting. And the understanding of the word alone creates this unrealistic expectation. And I often feel that a lot of people are expecting this exact magic number that will definitely happen. And it's that mismatch between the understanding of the word and the understanding of the practice that makes forecasting quite tough and a hard sell as well. So I guess my analogy here is I know what a car is. It doesn't make me a mechanic that can judge whether or not a car is roadworthy. And more to the point, it would be downright dangerous for me to attempt to do so. And so my final point about why I hate forecasting is that they're almost always wrong. So you could take 1,000 of the smartest data scientists in the world and they would create 1,000 different forecasts on the same subject using the same data. And they'd all roughly say the same thing, that next year would be a little bit more or a little bit less than this year. They will all be both equally wrong and equally right, and whichever one ends up being the closest will be purely by luck. And a nice little quote here, not from Michael Fish, but from the British statistician George E.P. Box, is that all forecasts are wrong and some are useful. And it's making them useful, which is the key thing here. But all is not lost. So people are always going to ask for forecasts, and they are important. So you need to find a way that works for you and your customers. And by that, I don't mean finding a single methodology that is going to work for everything. It's about finding that right blend of the science and the evidence with the art form and the subject matter expertise. This is particularly important in the current environment where services and demand patterns are changing like never before, because of kind of COVID-19 and the world we find ourselves in. So here are kind of 4 top tips for forecasting and how we at ECC have applied them to help plan for our different kind of short to medium term service scenarios. So these tips are going to kind of fly in the face of social distancing advice and guidance a little, but I'm going to urge everyone to kiss, caress, love, and ultimately wed. And I'll go through in more detail now as to why I want you to kiss and love. So kiss, keep it simple, stupid. A paper that has really resonated with me is Simple versus Complex Forecasting, the Evidence by Armstrong and Green. So here the evidence suggests that complexity in forecasts actually increases the risk of error. The more assumptions you include, the worse you're actually making your forecasts. And if you can get people to accept this, then you won half the battle. So our own simple approach has been to break down future demand into 3 simple components that you can see here on the right hand side of your screen. We have our expected normal demand. So what demand would we have experienced under normal circumstances? We have our demand driven by either a backlog or changes in practice. So any adjustments we then make as a result of current changes to practice we are experiencing right now. And finally, any new demand. So any potential new demand as a direct or indirect consequence of COVID-19, the kind of lockdown and the current environment. Change is always rare, everything stays the same, correct. So things are more likely to stay the same than change. That aforementioned simple versus complex paper suggests that the most accurate forecast model most of the time is the naive model. And this simply states the same thing will happen again, also known as the no change model. So in most circumstances, this is incredibly more likely than this huge sweeping change. But people kind of hear these catastrophized sound bites in media and think that 50% of the workforce are going to become unemployed, or there's going to be this huge second wave, or perhaps that pubs reopening is going to cause a spike. So some of these things may well happen, but anecdote is never a substitute for evidence. So unless there is any real hard evidence to suggest that something is going to change, we're going to assume that it will remain the same or continue as normal. And this leads us to our forecast starting point. What is the expected normal demand? So the world right now is anything but normal, but it's important to get a view on what demand levels should look like. And using historic data and making observations on past demand patterns, we can do this. So we took our demand flows from February 2017 through to February 2020 to create this baseline set of forecasts that represent a non-COVID world. And we used a series of time series statistical techniques to do this. This takes into consideration trend, seasonality, noise, recency, or any other components of a trend line to give us our expected normal demand. So this gives a really nice, solid, kind of science-based starting point. So remember that 50% science, 50% art form I mentioned? The more you can tip the balance in kind of science's favour, the better the forecast will be. And here we see our output from a nice and simple Holt-Winters time series forecast model. Our probable kind of forecast is this middle orange line, and then we also have these limits, these 95% confidence limits that show the kind of upper bounds and lower bounds, and we can almost treat this as a range for where we feel our demand will fall. So look at observed versus expected. How does what is happening now compare to what should happen and what has happened before? So now we know what should be happening. In these kind of hopefully unique times, we've already seen that these forecasts are wrong. What we expected to see in April, May, June, July, it clearly hasn't happened. And it's through understanding why they are wrong that helps us to predict what might happen next. So we've seen a significant drop in many of our services, and this is often because of a blockage in a pathway. For example, referrals to a service from an education setting will be nearly non-existent because of the temporary closure of schools. Counter to that, we've seen or expecting to see an increase in some of our services or outcomes, potentially as a result of changes in people's daily lives and circumstances. So we may see an increase in people accessing mental health services, for example. There's the potential that there may be an increase in access to kind of financial services because of a risk of increased unemployment or financial strain. So if you can obtain this holistic understanding of why current patterns are different to what was expected through your analysis, through research, through practitioner input, then you're in a better position to answer the next set of questions. How long do we expect this to continue for? So how long will things be kind of different? And what happens with any under or over demand that we are currently experiencing? So for something like children's social care referrals, for example, the reduced volumes doesn't necessarily mean that things are not occurring. It's rather more likely that a dominant referral route, such as education, has been severely disrupted, and hence they're not in a kind of position to make the kind of normal volume of referrals that they would do. So does this mean that when schools return to normal, possibly in September, that we're going to experience this deluge of this backlog? Likewise, if we believe that mental health services will come under increased pressure because of deteriorating health exacerbated through lockdown, does this mean that this particular group will all be okay once lockdown is eased? So in the chart here, we can see a kind of an example of referrals from education to some of our services. And we see a huge discrepancy between the expected referrals, which is the green line, and the actual observed referrals, April through July, which is the blue line. And the red line shows this cumulative deficits, which reaches kind of circa 550 by the end of July, which is about a third of total annual reviews from an education setting. So it's not an insignificant volume. So now, whilst we're starting to kind of veer away a bit from the kind of hard kind of science and start to kind of look at these assumptions and kind of the art form elements, we can ensure that we can make these assumptions as evidence-based as possible. For example, we know from our retrospective analysis of previous years that our peak children's social care referrals occur in October, which is a slight lag from the start of the school year. And so if we believe that a sizable proportion of this kind of backlog of this kind of circa 550 people may present themselves, how do we think this will happen? So here I've used a mathematical distribution model because I believe a backlog pool behaves very different to normal demand. So it won't be evenly distributed over the course of the next few months and years. There's a real risk that it kind of can return in quite an immediate and aggressive spike. So it's not in all cases, but there is that risk that once a blockage becomes unblocked, there's an immediate flood. So anyone that tried to get McDonald's or visit a recycling centre a couple of months ago will know what I mean. And so to Ed, what exacerbates demand? What are the drivers of demand and how might these be affected? So this is probably the trickiest part because there's not any real evidence robustly comparable to the current COVID climate that we can use. It simply doesn't exist. So let's stick to those previous principles. Let's keep it simple. What are the macro things, the biggest things that we think might impact upon demand for services? And there's no need to try and incorporate every tiniest potential element. So I promise you can spend forever making these tiny marginal adjustments to incrementally increase your forecast 1,000 times over, to only simultaneously make these kind of adjustments that incrementally decrease your forecast 1,000 times over, leaving you with the same numbers you started with, but with 4 months of your life lost forever. So let's stick with our top 3 things that evidence suggests impact upon our services. So again, using children's services as an example, the things which impact our demand are probably the number of children and families, any kind of policy or practice changes, and then finally kind of income deprivation affecting children. So I know that the number of children and young people in the county is not just going to suddenly double overnight. I also know that the number of children and young people in the county is expected to stay fairly stable for the next few years. I have no reason to believe that this will change. For anyone that's been kind of suggesting that there's going to be this post-COVID baby boom next year, IFA obviously has not been living through lockdown with children already. So I don't need to do anything here. Likewise, I don't know of any immediate policy or practice changes that might impact upon volumes. So this is actually an interesting one to pick up, because quite often if there's huge sweeping kind of big changes in kind of historical data, they're almost always driven by a change in practice or policy. They don't kind of cast off that as a possible reason for changes to your kind of demand. That only leaves us really with the income deprivation or poverty affecting households with children. So current economic research does suggest that there is this real risk of increased unemployment or financial stress. So if evidence tells us that Essex may experience let's say a 10% increase in unemployment, just as an example, what does this actually mean for children's services? So I can use historical national data to get some indication on that relationship between things like the number of households with children on income support versus the number of children known to social care, or many other relevant measures. And through some kind of simple kind of regression techniques, I can look at the kind of strength of this relationship. And all evidence does suggest that increased income deprivation does heighten the risk of requiring or being known to children's social care services. At that stage, I can make a kind of semi-crude assumption, but born out of evidence, that for every additional household out of work, there will be an additional X number of children known to social care services. So at this stage, we're kind of more in the realm of kind of scenario modelling and forecasting, but the two go hand in hand. And whilst this is kind of creating these several possible scenarios may seem like a means of kind of casting a net wide, it's important to be prepared for all potential outcomes. It may well be that as time progresses, you get a clearer indication on which scenario pathway you're on a trajectory towards. So putting all these things together, the expected normal demand, the demand driven by either a backlog or change in practice, and the new demand, this gives us some future demand scenarios. And these three scenarios give a realistic possible demand forecasts that are informed by statistical methodologies, historical observations, research and literature, and subject matter expertise. So I'd probably go as far as saying that these outputs are 75% science and 25% art form. And the beauty is, it's this simple approach we've been able to kind of transfer and use the same kind of broad method in adult services, kind of health services, police and crime, children's services, and many other. So I said I'd end by talking about why I love forecasting. To begin with, obviously, other forecast methods are available, and my conclusion is a rather kind of cop-out-ish, find an approach that works for you and your customers. Here today I've kind of shown that I've used time series methods, but in the past I've used kind of causal methods for forecasting, person level risk algorithms which I've aggregated upwards to create forecasts, Monte Carlo simulation and Markov chain modelling, and any other method you can possibly fathom for forecasting purposes. I guess the key kind of thing I want to kind of hammer home today is that combination of the science and the statistical backgrounds meeting that kind of art form to ensure that the forecasts kind of resonate with yourselves and customers. So in order for any of these methods to land, you need to incorporate some adjustments and assumptions, or whatever you want to call them. I guess what I will say, if you can keep these assumptions to a minimum and ensure they are grounded in evidence, then your final forecast outputs will be more reliable. And so again, to end by kind of saying a few reasons why I love forecasting. Forecasting is not an exact science. You get to work nicely alongside the service. You get a better understanding of the service itself by working alongside subject matter expertise, and together you can find this right blend of the science and the art. So not an exact science, but the combination is what makes it kind of an effective method. So forecasting is a word everyone understands, but a practice very few do. Essentially, your data analytics teams are the experts in forecasting, and you're always going to be in demand. Forecasting is always going to be required, and people will always need you to do that. And you can be the people that find this great mixture of the SME, the subject matter expertise, and the marrying up with the statistical methodologies and data science approaches. Forecasts are always wrong, but some are useful, and through understanding the aim of the forecasts to begin with, and through following a few of these simple rules, you can ensure that they have the desired effects and are indeed useful. Thank you very much for listening. If you have any questions, then please don't hesitate to contact my email address, stephen.simpkin@essex.gov.uk, is there on the bottom right of the screen. Thank you very much.